A patient walks up to your counter, red, irritated eye. You know the scene. It's probably one of the most common things you'll see all day. But the stakes? They can be surprisingly high. So today, we're going to build a clear, practical framework to help you make the right call, right there at the counter. So let's just dive right in with this scenario because it's a daily reality in any community pharmacy. Your first move is absolutely critical because a good, structured approach isn't just about helping the patient feel better. It can literally be the key to preserving their vision. So here's how we're going to break it down. We'll start with the initial presentation, then get into the really crucial stuff, spotting the red flags. After that, we'll figure out how to tell the common culprits apart, and then get into some real-world treatment and counseling tips. Okay, so a red eye, what does that really mean? At its core, it's just a sign of inflammation. And yeah, the vast majority of cases are totally benign. They'll go away on their own. But our first job, our primary job as clinicians, is to make sure we're not missing one of those rare but serious conditions that could threaten their sight. You know, every question you ask, every symptom you check, it all funnels down to this one single decision point. It's a fork in the road. Do I refer this person, or can I recommend something? This whole framework is designed to give you the confidence to make that call correctly every single time. And that brings us to what is arguably the most important part of your assessment. If a patient walks in with any of the warning signs we're about to go over, your job becomes very simple. The recommendation is direct, an immediate referral to an ophthalmologist. No hesitation. Seriously, before you even think about which eye drop is on sale or what might work best, your first responsibility is to run through this mental checklist of red flags. This is the safety net that you, as the pharmacist, provide for every single one of your patients. This table basically makes the decision for you. And notice the specifics here. We're talking about moderate to severe pain, not just a little scratchiness. We're asking, is your vision blurry at all? Any change? And that last one, a contact lens wearer who has pain, that is one of the highest risk scenarios you will see. Any one of these means stop, do not pass go, refer immediately. Now, this is a fantastic clinical pearl. It's a subtle but critical sign. Don't just look to see if the eye is red. Look where the redness is the most intense. If you see this deep, almost purplish redness right around the iris, the colored part of the eye, that suggests something much more serious is going on inside the eye, like iritis. It's not your typical pink eye. Okay, so you've gone through your red flag checklist, and thankfully, you've found none. Now your clinical detective skills really get to shine. We can start to figure out which of the common, manageable causes of conjunctivitis we're actually dealing with. The patient's story and the type of discharge are your best tools here. Is a discharge really watery, and did they just get over a cold? You're probably thinking viral. Is it that classic thick, yellow-green gunk that glues the eye shut, especially in a little kid? That screams bacterial. But if the patient's main complaint, the thing they cannot stop talking about, is an intense, unbearable itch, you should be thinking allergic every time. All right, so you've got a likely cause in mind. Now we can pivot to the fun part, effective treatment strategies and, just as important, those crucial counseling points that will help your patient recover faster and stop them from spreading it to their whole family. Before you even grab a product off the shelf, start with these fundamentals. Stopping contact lens wear? Absolutely non-negotiable. Hand hygiene is mission critical for infectious types. And look at the compresses. The type actually matters. Cold is great for the itching and inflammation of allergies, while warm helps loosen up that gunk in bacterial cases. Okay, we have to talk about this because it's the #1 trap patients fall into. They reach for whatever drop promises to get the red out. This is where you can provide some really valuable expertise and counsel them on the dark side of these popular vasoconstrictor drops. So what does that big phrase, rebound hyperemia, actually mean? Well, simply put, if you use these drops too much, they can actually make the problem worse. The blood vessels get used to the drug, and when it wears off, the redness comes back with a vengeance. The key counseling point here is short-term use only. Maximum of 3 days in a row, period. Now, this is a fantastic pro tip. For any patient who needs to use lubricating drops pretty frequently, guiding them towards a preservative-free option is just best practice. It completely avoids the risk of irritation from the preservative itself, which can actually cause symptoms that mimic the very problem they're trying to treat. This is such an important point, both for managing patient expectations and for antibiotic stewardship. Yes, topical antibiotics can maybe shorten the duration of a bacterial pink eye by a day or so, but most cases will clear up on their own. It's key to explain this so patients understand why you might not be recommending a prescription. So, let's just wrap this all up by talking about your crucial role in all this. As probably the most accessible healthcare professional out there, you are in the perfect spot to be a gatekeeper for your community's eye health. I love this. This four-word mantra really says it all, doesn't it? It perfectly summarizes your structured approach. You assess the patient, you triage them for any red flags, you provide essential counseling, and then you recommend treatment for the simple stuff. That is the incredible value you bring. So the next time a patient comes up to your counter with a red eye, just remember that your methodical assessment isn't just about good pharmacy practice, it's a critical safety net. Asking the right questions doesn't just lead to selling the right product, it can literally be the difference that saves someone's sight. Thanks for watching.